Namaskar. We would like to welcome you all on reproductive and child care programs, the Swasthavritta series, wellness series, inspired by Professor V.K. Agnihotri sir, our co-host, pillar of the AYUSH Samriddhi. So we would like to welcome you on this Wednesday on behalf of Independent Research Ethics Society in AYUSH Samriddhi International Webinar Series 1662. Now, figure is not important because your mentorship, your guidance, your cooperation, your active participation has reached beyond the limits of any number or any milestone. Thank you. This subject is unique because government has planned and implemented so many programs. So we are here to celebrate our Wednesday Wellness webinar. I would like to request Professor V.K. Agnihotri sir for his kind blessings, initial blessings and welcome of the speakers.
Thank you.
Respected V.K. Agnihotri.
थैंक यू प्रोफेसर पवन शर्मा जी, थैंक यू सो मच, नमस्कार। और हम अपने सभी आज के हमारे गेस्ट स्पीकर्स का बहुत बहुत स्वागत करते हैं। अभी लोग जो जुड़ गए हैं उन सबका भी बहुत बहुत स्वागत है मंच से। जैसा कि आपने बताया, ये वेडनेसडे है और बुधवार हमको हमेशा खुशी देता है क्योंकि उस समय हम अपने सब्जेक्ट के वेबिनार की सीरीज के सब्जेक्ट को लेके आते हैं। आज 1662वां हमारा पायदान पर पहुंचे हैं और हम बाय नेम कहते हैं। प्रोफेसर हमारे राहुल बंसल जी का हमें इंतजार है, वो मेरठ से जुड़ेंगे, जो हमारी कम्युनिटी हेल्थ के हेड ऑफ द डिपार्टमेंट प्रोफेसर हैं। प्रोफेसर पी सुधाकर रेड्डी जी जुड़ते हैं हमारे मैसूर से। और हमारे तीसरे वक्ता आज हमारे रहेंगे डॉक्टर माधवी गायकवाड़ जी। आपका बहुत बहुत स्वागत है। आप HOD हैं, प्रिंसिपल हैं शरीर विज्ञान से और प्रिंसिपल हैं नासिक में। डॉक्टर शालिनी मिश्रा ये जामनगर से जुड़ती हैं, उनका बहुत बहुत स्वागत है। रेड्डी साहब आ गए, नमस्कार। और हमारे आज के और हमारे जो अतिथि वक्ता है डॉक्टर तेजेंद्र सिंह, जो MD स्कॉलर है संस्कृत में और देहरादून से जुड़ते हैं। आप सबका बहुत बहुत स्वागत है। इसके साथ हमारे जो रेगुलर हमारे सपोर्टर्स, हमारे साथी सहयोगी हैं, प्रोफेसर निशांत शुक्ला जी, और आज के नए लोग सभी का बहुत बहुत स्वागत है, नमस्कार। विशेष रूप से हमारे अभी बघेल साहब जुड़े थे, अर्जुन बघेल जी जुड़े हुए हैं। और हाँ, डॉक्टर अमरीश अमरताल शाह साहब का बहुत बहुत स्वागत है। तो विषय पर आते हैं एक दो लाइन के साथ में, बाकी तो आज विद्वान सभी हमारे इसी तो अच्छे से बतलाएंगे। जब हम बात करते हैं रिप्रोडक्टिव एंड चाइल्ड केयर प्रोग्राम की, और जब ये प्रोग्राम एग्जिस्टेंस में आता है तो इसके पीछे जो बैकग्राउंड होता है, चाहे वो WHO का हो और उससे जुड़े हुए सारे वो कंट्रीज जो उनके पॉलिसीज को, उनके इंस्ट्रक्शंस को मानते हैं, तो ये कम्प्लीटली बेस्ड होता है हमारी पूर्व के सारे उन डाटाबेस, उन आंकड़ों पर जो मॉर्टिलिटी रेट, मदर मॉर्टिलिटी रेट और चाइल्ड मॉर्टिलिटी रेट पर डिपेंड करता है। क्या भारत कितना अभी भी उसको विकासशील कहते हैं या विकसित राष्ट्र की श्रेणी के लिए आगे बढ़ रहा है। और इस भारत की जो 75 और 78% जनसंख्या जो थी गांव में रहती थी, तो वहां पर मेडिकल फैसिलिटीज का इतना अवेलेबिलिटी न होने के कारण, अवेयरनेस न होने के कारण, हाइजीनिक कंडीशन उतनी अच्छी, आज हम बेशक रूरल हेल्थ को ज्यादा अच्छा मानेंगे, वहाँ की हेल्थ, आवा हवा, इन्वायरमेंट अच्छा है, लेकिन उस सेंस में कि मेडिकल हेल्थ नहीं थी। इस वजह से वहां पर प्रेगनेंसी बहुत होती थी, लेकिन सर्वाइवल जो था वो परसेंटेज कम हो जाता था। चाहे वो लोकल दाइयों की वजह से टिटनेस हो गया, पहले तो ये कहते थे वो नाल कटिंग में ही सावधानी नहीं बरती, एंड सो ऑन एंड सो फोर्थ। तो उसके बाद से जितने भी ANM का कॉन्सेप्ट, आशा वर्कर का कॉन्सेप्ट, PSC, CSC, इवन हमारा जो क्या है युवा मंगल दल, और यानी कितनी सपोर्टिव हुआ, उन्होंने सबने बड़ा हेल्प किया। आज हम इस रूप में आ गए हैं कि RCH एक फुल फ्लेजेड प्रोग्राम है जिससे हमारे डॉक्टर्स इन्वॉल्व रहते हैं और वो अपनी सेवाएं दे रहे हैं। एक बेसिक कॉन्सेप्ट दिया, बाकी आप सब लोग डिटेल्स बताएंगे। तो इन शब्दों के साथ तो एक बार पुनः अपने सभी गेस्ट स्पीकर्स का बहुत बहुत स्वागत करते हुए आज की सीरीज में के कार्यक्रम को आगे बढ़ाने के लिए प्रोफेसर पवन शर्मा जी से निवेदन करते हैं।
मैं आपसे करबद्ध प्रार्थना करूंगा। आज आपका विषय है, मालिक आप हैं, चेतना आप हैं, तो आप इस कार्यक्रम को लीड
चलिए
कीजिए।
चलिए,
आपका स्वागत।
आपका बहुत बहुत धन्यवाद है। मैं चाहता था कि प्रोफेसर बंसल साहब आ जाते तो हम उद्घाटन उनसे करवाते। कोई नहीं, हमारे सीनियर
नहीं, उन तो
प्रोफेसर
बाद
रेड्डी
में आ
साहब आ गए।
जाएंगे, कोई बात
हाँ
नहीं।
कोई नहीं,
वी
कोई
विल
नहीं,
नॉट
जब भी
वेट।
आएंगे, जब भी आएंगे। प्रोफेसर रेड्डी से हमारे साथ जुड़ चुके हैं, और प्रोफेसर रेड्डी जी भी बहुत सीनियर हैं, और पीजी सेक्शन के भी हेड हैं, और पीजी पीएचडी करा रहे हैं संस्कृत अपने जेएसएस मैसूर में। तो हम बहुत ही ऑनर के साथ में उनका बहुत रिस्पेक्टफुली स्वागत करते हैं, और उनसे निवेदन करते हैं कि वो अपनी प्रस्तुति दें। आई जस्ट वेलकम प्रोफेसर पी सुधाकर रेड्डी जी एंड रिक्वेस्ट हिम टू प्लीज बी हियर एंड present his presentation on the topic reproductive and child health program. नमस्कार सर।
नमस्कार सर, थैंक यू सर। नमस्कार, गुड इवनिंग टू ऑल। डॉक्टर शर्मा सर, अग्निहोत्र सर
वेलकम,
and
वेलकम,
Mr. Shukla
वेलकम।
sir and other dignitaries. Thank you very much, sir. And, sir, I have prepared so many, but time may be short. Just to move the slides, okay? Because the other person may come. It will only 1 hour time is there, and just I will say my
No problem.
views regarding reproductive and child programs. Is it visible, sir?
Yes, yes. You can go for slideshow.
Yes, sir. Is it okay, sir? Sir, am I
Yes.
audible? Is it okay?
Yes, yes.
Yes, sir. Written check program. Definitely, all comes under RCH. People have the ability to reproduce and regulate their fertility. Women are able to go through pregnancy and childbirth safely. The outcome of pregnancies is successful in terms of maternal, infant survival, and well-being. And couple are able to have sexual relations free of fear of pregnancy, contracting diseases. So if you see, analyze this RCH, reproductive and child health or reproductive and child care, this is that people are able to reproduce, number one. Number two, regulate their fertility. And women are able to go through pregnancy and childbirth safely. The outcome of pregnancy must be successful in terms of maternal and infant survival and well-being. And couple are able to have sexual relations free of fear of pregnancy and contracted diseases. For all this purpose, we have reproductive and child care programs to deliver how the ability to reproduce and contraceptives all comes under RCH. Now, see the RCH components: family planning, child survival, safe motherhood programs, prevention and management of RTI, RTI means reproductive tract infection, STDs, AIDS. And also it includes adolescent health care and family life education. And lastly, client approach to health care. So these are the components of the reproductive child care system. Now, if you see again individually, family planning. What family planning they will do? Improved methods. So whatever improvements are there, they will advise to undergo family planning techniques. And private sector inclusion, because not only government sector under RCH scheme, they also included private sector. And address quality. So quality methods addressing and collaborate with NACO in condom distribution. These are all comes under family planning component. And maternal component, quality antenatal care, institutional deliveries. So under RCH program, government is insisting that all deliveries must be undertaken in the institutional, so that we can reduce the infant mortality rate and maternal mortality rate. Skilled birth attendance, emergency obstetric care, home-based postpartum care, quality safe abortion services, and again RTI and STI, that sexually transmitted infection. These are all comes under maternal health component. And child health components are intensifying existing services like immunization, newborn care, micronutrient supply, control of diarrheal disease control, and acute respiratory tract infections. And lastly, integrated management of neonatal and child infections. So these are the health components of the children. And again, adolescent health, anemia, and awareness about the RH issues among the adolescent. So these are the RH components. Now, program objectives. What is the program objectives? Promotion of MCH, that is mother and child health, to ensure safe motherhood and child survival. So our ultimate motto is safe motherhood and child survival. Reduction of maternal and child morbidity and mortality, both maternal morbidity, maternal mortality. That means death rate among the pregnant women and also death rate after delivery also should be reduced. And child mortality includes infant mortality rate also. And lastly, the objective is attainment of population stabilization. For this purpose, family planning. So all this includes are the objectives of the RCH program. What are the highlights of the program? Integration of all programs related to fertility regulation, maternal child health, and reproductive health. Services are client-oriented, demand-driven through decentralized participatory process and target-free approach. There is no target. Whenever people are coming, they were asking, and that's called demand-driven programs. Upgradation of facilities like creation of first referral units from primary center to community centers to district gateway, like this way chain. And provision of specialist services for STD and RTI, provision of outreach services for vulnerable groups. Vulnerable groups, again, the pregnant women and also children. All these are the highlights of the program. And other programs related to reproductive and child health care. So, other than RCH program, we have Janani Suraksha Yojana, Janani Shishu Samraksha Karyakram, Navajata Shishu Samraksha Karyakram, Rashtriya Bala Swasthya Karyakram, Vande Mataram scheme, adolescent reproductive and sexual health. So all these are familiar words for everybody, but I would like to explain Vande Mataram scheme. This Vande Mataram scheme is running in urban area. Private obstetric gynecologist every week, one day, they should spend for free supply of iron folic acid tablets and also family planning services freely. They are private practitioners, but they will be keeping in front of the clinic Vande Mataram clinic. That means every Thursday they will be rendering services free to the
सर आप म्यूट हो गए हैं, अनम्यूट कर लीजिए।
वो नेटवर्क इश्यूज है।
आ गया ठीक
है सर। ओके सर। Other programs as I explained, and now this before reproductive child health care, there was ICD scheme, Integrated Child Development Scheme, CSSM, Child Survival and Safe Motherhood Program, and Mother and Child Health Program. Later, Family Welfare Program. So after Family Welfare Program, the RCH came. So this is the sequential order, the development in the reproductive and child health care. And MCH care previously, they defined as a promotive, preventive, curative, and rehabilitative health care of mother and child. The services intended for the purpose are known as MCH services. Importance of the MCH. Why we are giving importance to only mother and child or reproductive and child? because mother and child then constitutes approximately 60 to 70% of the population. That is why we are important. Secondly, they are more vulnerable group. Mother and child sickness and death are largely preventable. Mother and child comes under one unit. MCH is one of the Millennium Development Goal. So because of these reasons, we are giving importance to the mother and child. So if mother is healthy, child is healthy, the society will be healthy, the family will be healthy, community will be healthy. That's why we are giving importance to the MCH. And mother and child is one unit. Why it is considered one unit? During antenatal care, the fetus is a part of mother. The health of the child is intricately linked to the mother's health. Healthy mother brings forth a healthy baby. Certain diseases and conditions during pregnancy are likely to have their effects on the fetus. That's why we can call mother and child one unit we are treating. And even after the birth also, the baby is at least 6 months, up to 5 years, she will be attached. And during first few years of life, the child usually accompanies the mother during her visits to the health facilities. The mother is also the first teacher of the child. The mental and social development of the child depends upon the mother only. And that's why we are giving importance to the mother and child. The important text mothers are there. Women of reproductive age group, 15 to 49 years. Ayurveda with 12 to 15 years, 50 years. Child below 15 years, Ayurveda 16 years. Infant, a child below 1 year age, that's called Kshirada. So this is the important divisions of the mother and child. And indicators of the mother and child. IMR, that's called infant mortality rate. If infant mortality is less in a given community, we can say the health of the community is good. MMR, maternal mortality rate. During pregnancy, after delivery, how many mothers are dying? That's called MMR. And neonatal mortality rate. 1 days death rate. Under 5 mortality rate and low birth rate. So these are the indicators of the MCH. If MR is low, we have to say that the health is not good. We have to provide the healthcare services. That's why it's going to call indicators of the MCH. Now, the components of already discussed, that's called services mother, preconceptional advice, antenatal care, natal care, postnatal care, family planning. So these are the services for mother under RCH, under MCH. And the services children, neonatal care, post-neonatal care, 29 days to 1 year, preschool age 1 year to 4 years, and school age 5 to 14 years. And so till now I discussed about regarding the RCH and their program, other program. Now let us see whether Ayurveda will contribute in this RCH programs. Just quickly let us see importance of Ayurveda. We know that Ayurveda is a time-tested, reliable system of medicine. Ayurvedic regimen is safe, effective, easily available, cost-effective. So this is we have to remember. We have to say that it is safe, effective, easily available, and cost-effective. An integrated approach to safe motherhood, newborn health will be effective in achieving MGD goals in relation to MCH. And we know that very well in coming future, by 2030 or 2047, total India system will be integrated system. So where Ayurveda can integrate the modern. In this way, the Ayurvedic antenatal care and child care are reliable and also effective and easily available and cost effective. The present strategy is to provide MCH service in integrated package of essential health care known as PSC. So in all primary centers, there will be one AYUSH doctor as per the NRHM scheme. So we are integrating to the modern medicine to promote mother and child health. So what are the Ayurveda describes? Women care. Changes before menarche, we know very well. Duration of the menstrual period also mentioned. Intermenstrual period also mentioned. And mode of living during menstruation. So our mother care, reproductive care starts from the menstruation only. Rajaswala Charya. So during menstruation of 4 to 5 days, what are the do's and don'ts also Ayurveda mentioned very clearly. And up to 3rd day, what they should follow. And from 4th day of menstruation, what should follow. Also, they have mentioned clearly. And marriage is also they mentioned 16 years female, 25 years male. But it may be now according to Birth and Registration Act, Marriage Act, it may be different, but Ayurveda mentioned 16 years for female and 25 years male. Preconception, Garbhadharana, best age for conception for female is 16 years as per Ayurveda. Garbhadharana, Nisheda, below 16 years and above 50 years. So this is theoretically may not be now possible, but we can say that the Ayurveda also mentioned by 16 years, all dhatus will develop. That's why below 16 years, Garbhadharana is Nisheda. And antenatal care, Garbhini Paricharya, normal dietetics and mode of living of pregnant women also mentioned. And all the duties are mentioned listed. These are all, there is no time for us, but just dietetic and other regimen for pregnant women, they mentioned first month, second, all month-wise, they have given the antenatal care. If we follow this antenatal care, we can reduce the maternal mortality as well as the infant mortality. See, first month, Madhura Shita Drava, non-medicated cold milk and agreeable food morning and evening. Second month, milk prepared with the drugs of Madhurasa. Third month, Kshira plus Madhu plus Gruta. Shashtikara rice plus Kshira. Shali rice plus Kshira. Third month. Fourth month, again, 1 tola takra extracted from the Kshira. Shashtika rice with takra. Palatable food with takra. And meat soup of wild animals. Shali rice and curd in fourth month. Fifth month, Gruta again mentioned. And sixth month onwards, Gruta prepared with drugs having Madhurasa. Gruta prepared with Gokshara or Peya, Shali rice and Gruta. Seventh month, same as above. Again, management of Daha, Kandu, Kikkisa. Gruta prepared with Pratak Parnyadi Gana. Eighth month, Dugdha Peya along with Gruta. Snigdha Peya, Astapana Basti, Anvasana Basti, use of Jangala Mamsa, etc. So in the 8th month onwards, the Basti can be given. As we know, in the 8th month of pregnancy, there will be Astira Vojas. So to get Stiratva for Vojas, we have this regimen. 9th month, same as 8th month, etc. So this scientifically, if we see, now during pregnancy, they need more nutritious food. Especially milk consists of all the nutrients, and also ghee is there, and rice is there, and also pulses. So all the nutrients which are prescribing by modern medicine is mentioned by Acharyas during pregnancy, Garbhini Paricharya. And specific water pregnant women also they mentioned. And commonly used Ayurvedic preparations in India, Madhyapala Rasayana widely used for especially the morning sickness will be there for them, like hyperemesis gravidarum will be there. For this purpose, Madhyapala Rasayana, and also it prevents the constipation. And Dhatri Loha, it improves the hemoglobin level, prevents the anemia, Loha Mandura, Punarva Mandura, and Jirakarishta. So these are all again scientifically also proved. There are publications also available. Madhyapala Rasayana, Dhatri Loha, Loha Mandura, Punarva Mandura, Jirakarishta. And regarding the intranatal, so just delivery is going to occur. That for birth construction Sutika Gara is also mentioned. Postnatal, after delivery, again Sutika Kala is a 1.5 month, 45 days. All Acharyas suggested regulated, restricted, specific dietetics and mode of life also. Massage with Bala Taila, very, very important dimension. Oral administration of the fats with medicine, decoction for 3 to 7 days also mentioned. Use of medicated rice gruel in diet mentioned. From 7th to 12th day, medicated meat soup is advocated. So here again, more iron, protein diet is indicated meat soup. So until 7th day, after 12th day, we can go for rice and etc. After 12th day, they can go for the meat soup. And prescription of the Panchakola Sneha, after 7 days, gradual Brahmana should be done. And Vadrudaru Kashaya, Panchakola Jagri they mentioned. 7th day, cooked rice also mentioned. An interconception period, that's called maybe below 6 days. Medicines for constriction of the vagina also mentioned. Paste of palasha, fruits of udumbara mixed with taila is good for medicine, good medicine for that purpose. Prescription for reducing the belly after delivery. This is very, very important. After delivery, the lady may complain that the belly is more or fat is accumulated in the abdominal region. For this purpose, buttermilk mixed with the powder or paste of Kanajata should be used. Commonly used preparation of postnatal care are Jirakarishta, Balantakada, and Saubhaga Shunti. Widely used Saubhaga Shunti and Jirakarishta. And contraceptive methods also mentioned externally and also internally they have mentioned. So that way, for mother, family will contraceptives, antenatal care, postnatal care, internatal care has been described elaborately in Ayurveda. And child care of newborn also mentioned, especially immediate measures. If child is not crying, what we should do? Resuscitation. As modern medicine also says that they'll tap on the buttocks. So here what they say? Resuscitation by sticking the stones, so 2 stones and rubbing it so that the child may listen and we may cry. So cold water sprinkling, cleaning of the oral cavity, keeping cotton pad soaked in balataila. These are the resuscitation purpose. And removal of garbhodaka by grita and sandhavalana, cutting of umbilical cord and jatakarma mentioned, massage and bath with balataila mentioned, jatakarma, that is licking of mixture of honey, ghee and ananta, that is gold. So if possible gold, otherwise minimum honey and ghee on the tongue is called as jatakarma. It improves the immunity power to the child. It is old age, the golden method to improve the immunity of the resuscitation of unconscious child also mentioned, and cutting and care of umbilical cord, 8 anglas and umbilicus mentioned by acharyas, and also after cutting we have to face with the Kushtataila irrigation. That is nowadays we are in the antiseptics. So here in Ayurveda they mentioned Kushtataila. And general care for infant, bath, massage with Balataila and bath with Kshiri Vriksha Kashaya, and also mentioned. And feeding of the first 4 days. First day, honey and ghee, right breastfeed feed if possible. And first day, honey, ghee, ananta in baby's palmful quantity, that's twice daily. Second and third day, ghee prepared with Lakshmana tree, Lakshmana plant. And fourth day, honey plus ghee 2 times a day. From evening, breastfeeding should be started. But exactly speaking, now modern says that immediately after birth, within 2 hours, the breastfeed must be done, given, because it contains cholesterol. But Ayurveda mentioned, if you are not getting milk first day, second day, etc., this food can be given for the child. And cloths and beds also mentioned, protective measures, Rakshogna Karma also mentioned, and general care for child also, like protective measures like use of amulets for the prevent diseases, increasing the strength and destroying the enemies, long life, happy life also they mentioned, Dhupana Karma also mentioned, protecting from poison also mentioned, and general care and hygiene like massage and ointment to provide strength to skin, because skin infection can be reduced by massage and applying the oil to the body. That's exactly Kushtataila. And bath, cleaning of the teeth also they mentioned. And for children, Swarnabhasma plus Brahmi paste, Shankapushpi with honey and Grita. All are improving the immunity and also memory power. Swarnabhasma plus Arkapushpi, Vacha, Swarnabhasma plus Kaidarya and Durva Swarasa. All these things will tones up the process of growth and development to provide supplementary nutrition. It provides general immunity, body resistant, and helpful in growth and development, and has the intelligence. So ultimately, we want these things in the child. So everything will be provided by Ayurvedic Swarna Prasana, what we can call nowadays, familiar with Swarna Prasana. And Kshirada, if can be given, Kshiranada, medicated Gruta, and Annada, when there's child is only for Anna, that's medicated Gruta, Dasamola, it should be given. And Lehana Karma for Swarna Prasana, Brahmi Gruta, Manjistari Gruta, Abhaya Gruta, and Samvardhan Gruta. So these are all, again, publications are available. These are all safe and also effective in providing strength, immunity, and development of the child. And these are child samskaras, the most important and very significant contribution of Ayurveda for child is childhood samskaras. Ashtadha samskaras, Shodasa samskaras are there. At birth, Jatakarma, 11th and 100th day, that's Namakarana, and 12th and 13th day, Dola Lena, keeping child in the Dola, and during first month, Suryodaya, and Jala Puja, 4th month, Nishkramana, taking child to the out of the house to go to temple, and 5th month, Upaveshana, the child is made to sit daily for some time, that's Upaveshana. 6th month, Phalaprasana, introducing to the child. 6 to 8 months, Karna Vedana, piercing the ear lobes. This again improves the immunity. It gets immunity mechanism from the wound. So when wound occurs, how immunity can be. So that way, Ayurveda mentioned Karna Vedana, purposefully you are doing, that is equal to wound. That is by initiating the immunization mechanism from the wound. Ornamental purpose also it will be useful. And 10th month, Annaprasana, introducing the semi-solid foods to the child when teeth eruption takes place. And Ayurveda stands in RCH, we can say that for mother, we have proper antenatal care, proper postnatal care, and for children purpose, we have Shoda Samskara and Swarnaprasana. Thus, to promote comprehensive health of both mother and child, there is a Ayurveda stand is there. Okay. And to conclude, it is a time when basic concept of Ayurveda and Ayurvedic cost-effective management in relation to mother and child health be promoted, prolonged globally, and in India especially. Only an integrated approach to safe motherhood and newborn health will be effective in achieving the MDG in relation to the MCH, Millennium Development Goals. Thank you, sir. Thank you very much for giving this opportunity. I think I have done some justice to today's topic. It is very elaborative, but I made into short because of time constraint. There are so many speakers are there.
Thank you, Professor Reddy sir. Thank you so much. You made all efforts to complete the topic with all aspects, and rather I should say that you have poured the whole ocean in a very small pot. This is what the Gagar Sagar, and you made the reproductive and child care program vital with an Ayurvedic approach. The whole of the literature, whatever is there, right from the Garvani Charya to Prasuvottar Charya, you have completed. So thank you so much for your knowledge and for your presence and of course for your time. Thank you so much, and please be.
Thank you, sir. Thank you very much.
Thank you.
Yes, sir. I will be there, sir. Now, thank you, sir. Thank you very much.
Now, in this connection, I would like to invite our next guest speaker, and she is Dr. Madhavi Gaikwad. She is head of the department, professor head of the department, Kriyachari, and also principal, Matoshri Ayurvedic College, Nasik. So I welcome her, Dr. Madhavi Gaikwad. Namaskar.
Sir, namaskar. Good evening to all. Am I audible, sir?
Yeah, sure.
So I would like to thank, first of all, Independent Research Ethics Society International Interdisciplinary Institute for Research Education and Skills, AYUSH SAMRIDDHI International Webinar Series, the Dr. Professor Pavan Sharma sir, Professor Vishnu Sharma sir, and Professor Vineet Agnihotri जी, मैं बहुत बहुत धन्यवाद देती हूँ, आपने मुझे इनवाइट किया है आज. मेरा आज का जो टॉपिक है वेबिनार में रिप्रोडक्टिव एंड चाइल्ड हेल्थ केयर प्रोग्राम, स्क्रीन शेयर
आप शुरू करिए, आप कंटिन्यू करिए.
जी बिल्कुल सर, बिल्कुल. So today's topic is reproductive and child health program. Myself, Dr. Madhavi Gaikwad. I am HOD, Kriyachari department. I am doing my PhD, and I am also principal at Matoshri Ayurveda College, Intl, Nasik. So the introduction of the healthcare program. The Reproductive and Child Health Program was formally launched by Government of India on 15th October 1997 as per recommendation of International Conference on Population and Development Health in Cairo in 1994. In ICPD, that is International Conference on Population and Development, which is held at Cairo, define RCH as a state of complete physical, mental, physical, mental, and social well-being, and merely the absence of disease of infirmity
आपका
in all
प्रेजेंटेशन
persons.
चाहे तो शेयर कर लीजिए, हमारी तरफ से कोई रुकावट नहीं है।
हाँ जी सर।
आप प्रेजेंटेशन चाहें तो शेयर कर लीजिए, हमारी तरफ
जी
से कोई रुकावट नहीं है। प्लीज
हाँ जी
शेयर।
सर। जी जी, शेयर नहीं हुआ है। करूंगी। हाँ, बोलूंगी। So is it okay, sir?
यस सर, आ गया, गुड। तो
Okay.
स्लाइड शो में कर लीजिए।
जी जी, ये स्लाइड शो हो गया है। Okay.
हाँ, स्लाइड शो कर फ्रॉम द बिगिनिंग।
No, now the next one.
चले
Yes. Okay.
Oh.
Okay. A state in which people have the ability to reproduce and regulate their fertility are able to go through pregnancy and childbirth. The outcome of pregnancy is successful in terms of maternal and infant survival and well-being, and couples are able to have sexual relationship with free of the fear of pregnancy and of contracting diseases. Now, the objective of this RCH are to permit the health of the mothers and children, to ensure safe motherhood and child survival. The intermediate objective is to reduce IMR and MMR. The ultimate objective is population stabilization through responsible intervention. Concept of RCH: prevention and management of unwanted pregnancy, maternal care, the mother should be safe, child survival, prevention and management of RTIs, STD, and prevention of HIV and AIDS. Components of RCH: following services are included in the reproductive health area as proposed by Government of India: family planning, child survival and safe motherhood program, prevention or management of RTI or STD and AIDS, client approach to healthcare. Other activities: providing counseling. The most important part is counseling, information and communication services on health, sexuality and gender difference. Referral services for all above intervention, growth monitoring, nutrition education, reproductive health services for adolescents. RCH package for various services are: for maternal services, the servicer components are obstetric care, infection control, and nutrition promotion. For child services, the essential care of the newborn, including care of the at-risk newborn by prompt referral services, infection control measure, and nutritional promotion. Reproductive health, the fertility control, we have to control our fertility. Then MTP services for prevention and management of unwanted pregnancies, adolescents, HIV, or we can say AIDS. RCH program phase 1 included. Under the RCH program phase 1, various provisions were made to improve the status of maternal and child health. These include: one is provision of essential emergency and essential care, provision of equipment and drug kits to selected PHCs and selected FRUs in the districts. Provision for additional A&M, staff nurses, and laboratory technicians for selected districts. Provision for 22 hours delivery services at PHCs and CHS. Referral transport in case of obstetric complications, immunization and oral rehydration therapy, prevention and control of vitamin A deficiency in children. New initiative undertaken during phase 1 of RCHR, setting up of blood storage units, training of MBBS doctors in anesthetic skills for emergency obstetric care, lacunae, the outreach services were not available to the vulnerable and needy population. The management of financial resources were inadequate. The human resources such as doctors, nurses, health workers, etc. were deficient. The management information and evaluation system was lacking. The effective network of first referral units was lacking. Quality of service in PSCs and CSCs was poor. Lack of community participation. Phase 2 RCH2 was started from 1st April 2005 to 2009. RCH2 vision articulates improving access, use, and quality of RCH services, especially for the poor and undeserved. Aim of the RCH2 are to reduce infant mortality rate, to reduce maternal mortality rate, to reduce total infertility rate, to reduce couple protection rate, immunization coverage, especially in rural areas. Objective of RCH2 to improve the management performance, to develop human resources intensively, to expand RCH services to travel areas also, to monitor and evaluate the services, to improve the quality, coverage, and effectiveness of the existing family welfare services and essential RCH services, with a special focus on the above mentioned EAG states. Components of RCH are population stabilization, maternal health, newborn care, child health, adolescent health, urban health, tribal health, monitoring and evaluating. So the population stabilization, by increasing the number of trained personnel like medical officer of PHC and female health worker of sub-centers, by covering the services at grassroots level, by having linkage with ICDs, involving Panchayati Raj institution, urban local bodies and NGOs, by training one couple from each village to provide non-clinical family planning methods services, by involving district urban development authority, cooperative societies and industrial workers in providing family planning services, by identifying NGOs to provide financial, technical and managerial support. Nowadays, NGOs are doing their good work in this field. Maternal health, reproductive health, we can see the strategies to improve and strengthen the quality of maternal services are: one is essential obstetric care, the most important thing; 3 or more antenatal checkups; 2 doses of tetanus; 1 pack of iron folic acid tablets during the last trimester; counseling, the most important part again, on promoting of institutional delivery; emergency obstetric care. So emergency obstetric care, this consists of operational zinc, the first referral unit to be fully functional around the clock, that is 24 hours. First referral unit, it is an upgraded PHC, we can say CSC, into a 30-bedded hospital having a well-furnished and equipped operational theatre with a newborn care corner, a labor room, blood bank, and laboratory to provide the services of obstetric emergencies such as cesarean section and adequate supply of drugs to the patients, care of sick children, family welfare services. Newer schemes are the Professor Swasthavritta Reddy sir, they have given the knowledge of these things, but I am repeating that. Janani Suraksha Yojana scheme, Prasuti Riker, training of traditional birth attendants, training of MOs in the skill of obstetric management. Newborn care and child health, the effective health intervention for newborn starting from the maternal period, intrapartum and immediate newborn care, early newborn care, late newborn care, Navajat Shishu Suraksha Karyakram. It includes the main aspects of NSSK prevention of hypothermia, prevention of infection, early initiation of breastfeeding. Facility-based IMNCR, it focuses on providing appropriate inpatient management of the major cause of neonatal and childhood mortality, sick newborn care, and home-based care. Adolescent health, this is implemented on pilot basis in those districts where more than 60% girls marry before age of 18. The adolescent health services are provided by counseling once in a week in the PSCs and CSC, the services of or management of menstrual disorders, nutrition counseling, counseling for sexual problems. Urban health, this is improved by providing quality primary health care to the urban poor by establishing urban health center. Ratio is 50,000 populations, where medical officer, 3-4 A&M, sisters, lab assistant, 1 public health nurse, 1 clerk, 1 peon, 1 chowkidar also should be there. The tribal health, that is vulnerable population. These are the people who are unreserved due to problems of geographical access and those who suffer social and economical disadvantage, such as SC or ST and urban poor. Goal to improve their health status, and the objectives are to bring their health status at par with the rest of the population. Monitoring and evaluation, management, information and evaluation system. This is done by following measures. Planning is done at various level of sub-center, PSC or CSC, district and state. Monitoring is done by establishing consumer need assessment approach cell at district and state level with an officer in charge. Evaluation is done through district survey, national family health survey, focus studies, and census report. Validation is by supervision and survey. Other priority areas are health education, TB control program, store and distribution of anti-malarial drugs, ANC services, contraceptive distribution, referral for terminal method. Thank you.
Thank you, ma'am. Thank you so much. Very concise and to the point presentation given by your side, and I think most of the areas are well covered by Professor Reddy. As such, you mentioned also. In this way, and we are getting more and more information regarding the RCH program and its practical aspect, which could be possible to achieve with the help of the all narrations of our IRD text. So it's a say combined effort, and that's why for this RCH purpose, our IRD graduates are also posted as medical officer. They are doing very well under the guidance of their seniors and the PSC or CSC in charge. So thank you so much, and again thanks for your joining. Thank you.
Thank you. Thank you.
Thank you. Now it will be our pleasure to invite our next guest speaker of today's webinar, and she is Dr. Shalini Mishra from Jamnagar. I think she is very much with us. So, namaskar, Shalini. Please start your presentation. Yes.
Namaskar, sir.
Namaskar.
I am very thankful, sir, for inviting me as a speaker.
आवाज बढ़ाइए, आवाज.
Yes. Hello, I'm audible, sir. Yes, thank you, sir. As previous two guest speakers already covered RCS program's main points, so I tried to escape all these repetitions due to very less time. So I mainly focused over the Ayurveda aspect of the RCH, which may be included in the future for the better project. So how we can explain this? So as the topic today is the reproductive and child health care and how Ayurveda play an important role for the achieving all these aspects. We are going to start with this quotations. Aputrasya griham sunyam, disha sunyastva bandhava, murkhasya hridayam sunyam, sarv sunya daridrita. So how we can achieve all these problems to remove and improve the putra in the grih with bandha, and how to improve the intelligence conditions in the child, and how to improve their financial situations also. Because infertility or reproductive problems and child problems all decreases the financial conditions, and it increases the burden, financial burden over the country, even world, and over the unit of the world is the family. So how we can achieve this by the Ayurveda? As WHO also focus that what is the part comes under the reproductive health and child care. So we can say obviously reproductive health is a state of complete physical, mental, and social well-being. Means not merely the absence of disease or infirmity in the matter related to the reproductive system and to its function and process. So not only the disease, but it means the well-being, as the topic of today Wednesday is the well-being. So how we can achieve not only the long life, along with the long life, we obviously required healthy and long life. So this is the part which must be considered under the RCH programs. First aim to reduce the mortality, mother and child mortality. So MMR and IMR. Nowadays, near about in India have the near about 100 per 10,000 populations maternal mortality rate, as near about 30 to 35 infant mortality rate. So this is very much high as compared to other developed countries. In the developed countries, mortality rate is not an issue, whereas in the India is mortality rate is main issue. In other developed country, reproductive problems, congenital developments, IUGR problems, birth defects, all these are the major problems. So different countries, so different required conditions according to the reproductive health and child care. So, but we focus the mainly our developing countries and underdeveloped countries where have the nutrition, infection, and all these are the main problems. But when we follow the Ayurveda aspects, we obviously reduce the nutritional problem also, and we increases the child health, child quality, mother health, and mother well-being. So all these by these aspects, we can achieve this. Nowadays, this is the condition scenario of the infertility and disease condition in the congenital disorders. Near about 1 out of 6 person have the infertility, or maybe whole life, or maybe some part of the life which faces the infertility situations. And congenital disorders is also very much high. If person is baby is live by trying to manage all the emergency programs, but if they have no quality, have 100% rate dependent, then it is not a good condition, and now it is possible to achieve the well-being for the countries or the world. Near about 50% of their conditions are considered in the dependent condition. So, and also congenital deformity causes the social stigma and make the life very difficult. So not only to improve the life, means in the life span, obviously it improve the morbidity condition to reduce and improve the quality of life as a well-being. As I recently, this picture is published, this article published in the Times of India, 20% preterm birth. So preterm birth, stillbirth, congenital deformities, all these are the very much problems in this present era. So how we change this scenario by improving the mother health and child health? This is the common diseases which comes under the reproductive systems that hamper the quality for the progeny, and the infertility all causes very high rate. So not only not only the reproductive diseases, also like for common conditions, diabetes, hypertension, cholesterol, heart disease, and all other conditions also may hamper the reproductive health system. As RCH program mainly focus on the reduce the mortality rate, mother and child, and to ensure the quality service to pregnant women and child also in the country. So quality service to the pregnant woman, which means not only to change the emergency situation and to handle the emergency situations, but nowadays normal delivery is very rare, as previously LSCS is rare. Now LSCS is common, whereas normal delivery is very rare. So obviously this is the most important condition to increases the morbidity of the mother conditions. So how to reduce these situations? As now, according to AYUSH systems, they started the Supraja. It means obviously along with the life, quality of the mother and child is also important. So to provide the optimum protection to fetus and mother, so as to reduce the maternal and neonatal morbidity and mortality, to ensure continuous medical surveillance and prophylaxis for the development of the fetus, and to prevent complications, if any, achieved during the normal delivery. So this is the change in the Supraja and RCH program. So how it improved this from RCH to Supraja conditions?
अली क्या हुआ?
सर शायद स्लाइड रुक गई है, so just
कोई नहीं,
minute,
आप कंटिन्यू करिए, आपके सामने तो हुई।
हाँ नहीं सर, कंप्यूटर में ही पूरा रुक गया है।
अच्छा
हाँ सर, so sir, it is visible, slide is visible sir?
No,
Okay sir.
not yet. Not yet. Professional.
अग्निहोत्री सर,
सर वो उनकी स्लाइड रुक गई है, हमने बात किया ना, आप कंटिन्यू करिए, आपके पास अगर है
हाँ सर,
literature,
ओके सर.
जी।
Sir. So now we start the reproductive health, how it is important. It started from the reproductive health system first. In the ladies, it started from the Ritumati, as we can say. Otherwise, it causes the infertility. So how can explain this? Gate purane rajasi nave cha avasthite sudisnata striyam avyapannam yoni shonita garbhashaya ritumati cha akshame. So it means if this situation occurs, we can say this is the healthy woman. Otherwise, it may cause annena bandhyam nirashyati. So otherwise, it may causes the infertility, and it is very impossible to produce the progeny. So that's why it is started from the reproductive systems health, and that's why it is named as a RCH. And why it happened? Obviously, it changes occurs due to our irregular lifestyle. We can say mithyacharena strinam pradustenartavena cha jayante bij doshacha devacha srinuta pratham. Means mithyachare or asamyak ahar vihar, all these may causes the arthagat bij dusti. Means have some changes in the ovum and other required elements for the fertility and for the production of the issues. So how we can change this conditions? Obviously, every person, every mother should behave as a ideal lifestyle. As we can say, ubhay lokahitam ahar vihar system. This type of ahar lifestyle should be maintained. That can causes best in even future life also. So ubhay lokahitam means in present, in future, both time that should produces the best condition for the health. And it should be pratidine yat kartavya. Not means only we can follow the for 4 months, 10 months, and like 1 year. No, this is should be followed by a full life span. Then it can maintain the health. And how we can say this is the condition? We can say this is the ubhay lokitam, which type of ahar? Obviously, we can say देशकालात्मगुण विपरीतानां हि कर्मणा आहार विकाराणां च क्रिया उपयोगः सम्यक् सर्वातियोग संधारणम् असंधारणम् उदीर्णानां च गतिमतां सहसानां च वर्जनम्. Means obviously every person should have the knowledge which type of कर्म should be performed by the lady and which type of food, which type of activity. Just we can say अगर हम कोई भी दूषित आहार विहार का सेवन करते हैं, केवल आहार विहार ही नहीं, even their behavior, their lifestyle, all are responsible for the reproductive health. So in this this is the general conditions. And nowadays, sahas varjan and sandharan, veg dharan is a very important cause for the reproductive diseases. So nowadays, how we can change? Obviously, every mother and every parents want to get a very specific baby. Means we can say very ideal fetus and ideal child. Obviously, they imagine for their children. So how we can achieve this? We can say this is the design. Obviously, it's in the hand of parents. अगर ये सभी उनके माता पिता के हाथ में ही होता है कि उनका बच्चा कैसा हो सकता है एंड कैसे उनके जेनेटिक चेंजेस हम कर सकते हैं. Obviously, it started from the first, from the lifestyle of the mother. Just first start with the Rajashwalacharya. Means in the whole life span, in the reproductive age group, Rajashwalacharya is very important and should be incorporated in the every आयुष सेक्टर. एंड जस्ट वी कैन से अभी जैसे बहुत सारे हॉस्पिटल्स हमने शुरू किए हैं आयुष मंत्रालय ने, जिसमें हम उनको वेलबींग की ही कंडीशंस ज्यादा प्रोवाइड करते हैं. तो उसके लिए उनके लाइफ स्टाइल को कैसे, हाँ सर, कैसे चेंज कर सकते हैं. तो वी कैन स्टार्ट फ्रॉम द रजस्वलाचर्या. एज ड्यूरिंग रजस्वला वी प्रोवाइड द मिल्क, घी, राइस, yawa, kheer, we can payasam. So all these are the main food material during the Rajashwalacharya to prevent the other reproductive disease and also maintain the brahmacharya, avoid the divasayan, asrupat, pradhavan, ayas, all type of ati snan, anulepan, abhyak, all these type of ati dhavan, मीन्स लड़ाई झगड़ा, इस तरह के क्रोध, अभी सभी तरह के मानसिक भावों को नियंत्रित रखने के लिए उनको हम प्रशिक्षित कर सकते हैं। तो इस तरह से रजस्वला के दौरान अगर हम अपनी लाइफस्टाइल को अच्छा रखते हैं, वी कैन से द रिप्रोडक्टिव लाइफस्टाइल आल्सो शुड बी मेंटेन्ड। So during this, how to produce after this, first before conception, health is also important. Before going for conception, first check the health of the mother. How we can achieve this health for the mother and baby till the birth of the baby. So obviously before conception, most important things, first assess the mother health. Obviously, according to Ayurveda, they recommended that first go for the Shodhan process, like Vaman, Virechan, Basti, all these type, Anvasan, Sthapan Basti, that can improve the mother health and the Garbhasaya health. So all the reproductive health is also improved before going to conception. So this is the important condition. It reduces the stillbirth also, birth defect also, even miscarriage and all these things, and easy for conceptions. It increases the conception rate also. So this is the condition. How we can improve the morbidity. So this is the first step. Go for the Shodhan process before conceptions. And second, along with the this process, mantra is also important. Acharya Charak mentioned one mantra that should be practiced by the parent, by the lady, and during the conceptions, ahirasi ayurasi sarvata pratisthasi dhata त्वा ददातु विधाता त्वा ददातु ब्रह्म वर्चसा भविति ब्रह्म बृहस्पतिर विष्णु सोमः सूर्यस्तथा अश्विनो भगो अथः मित्र वारुणो वीरम ददतु मे सुतम. Means when we request along with the all Ayurvedic procedures, medical treatments, mantra means for the mental peace and for the remove the tension, it increases the conception rate. So this is also important part for improving the conditions and reducing the failure rate. Next, after conception, we can say in the antenatal care, provide the some special lifestyle and dietary patterns, like to prevent the for the prevention the mother and child morbidity and mortality, and also prevent the nutritional loss, congenital abnormalities, and to decrease the morbidity, like in the different like IUGR, low birth weight, stillbirth, so preterm delivery, all these may can decreases by the following like good lifestyle and dietary care. As presently, first prenatal give the advices how to increase gradually. Nutritional increasement is required. Not means ki abruptly in the first trimester, if we increases the more protein diet and more fat diet, it not improve the health of mother and child. It decreases the mother and child health. Overnutrition and undernutrition both are harmful for both mother and fetus. So gradually, that's why Acharya started with the some liquid diets as required, only milk preparation, not started with the high protein diet in the first trimester. It started from the second and third trimesters as required gradually. So 300 to 500 kilocalorie we can add step by step. So in the first trimester, 200 to 300 kilocalorie extra as normal calorific value, we can add 2 to 3 calories. If we can added extra protein, it causes the some genetic deformity. So this is also important and increases the ammonia and nitrogen oxide peroxide reactions more, and it causes the placental deformity. So this is most important condition, not to increases abruptly in the first trimester more nutrition, or we can increase the load of nutrition. Obviously, gradually we can increase. After that, it also important how to prevent the fall, means we can say prevent the miscarriage. Some conditions like some behaviors, proper sitting and position is also important. Don't suppress the natural urges. Vat, Mutra, Purish, Veguru, Avarodha, Sandhara, it is also important to remove this. And improper physical exercise, Daruna, Anuchit Vyayam, it causes the miscarriage, missed abortions, all. And along with this, Tikshna, Ushna, Ati Matra is also important to avoided by the pregnant lady. So all these conditions, Pramit Asan is important. Normal food as required, not too much, not less. That required and fulfill the requirement of mother and fetus. This is the Garbhopaghat Garbhav, how to prevent this. Then we started the Masanumasik Ahara Achar. Ahar conditions, as obviously first trimester give the milk preparations, like liquid diet also, because in the first trimester have the chances of more loss of water due to vomiting and all these conditions. So it increases the demand of liquid. So in this condition, increases the demand of liquid and protein also. So milk protein is the best for improving the mother and fetus growth. So Kheer and Kheer product is most important. The second mass, first trimester, first, second, and third, we give the madhur preparation along with the Kheer. And next, from the second trimester, we started some solid food. So Kheer Navneet also increases the fat quantity. Kheer Sarpi, Kheer Sarpi Madhur Siddha. This is the condition. So from the Saptami Mase, we started some, we can say, Mutra Virechiniya Varga to reduce the preeclampsia conditions and to reduce the congestion in the lady. So this is the condition. From the 8th and 9th month, we started the Anuvasana and Niruvasti for the normal labor. This is the most important condition nowadays. How to improve the normal labor and how to achieve the normal labor. This is the most conditions. Along with the daily physical activity at the 8th or 9th month, Anuvasana and Niruvasti is most important to achieve the normal labor. So next one is during this Masanumasik food charya, some conditions, behaviors is also important that causes some genetic disorders, as we can prevent this. कभी हमने ऐसा भी सोचा कि कोई बच्चा बहुत अच्छा होता है, गुड सेल्फ कंट्रोल होते हैं, कुछ बच्चे का अपना खुद का कंट्रोल नहीं होता है, कोई लड़ाई कर सकता, तो सभी की कंडीशंस ऐसी क्यों अलग अलग है और सभी में ऐसा क्यों होता है? ऑब्वियसली इट्स डिपेंड ऑन द मदर बिहेवियर्स. इफ लेडी कैन, हमेशा अगर वो सीधा सो प्रतत उत्तान साइना, so maybe have a chances of umbilical cord around the neck, it may causes the death. Second, sleep in open place like आसमान के नीचे ऐसा कुछ हो, विवृत साइन, नक्तचारिना, it may causes some psychosomatic disorders. Second, some lady have the behave like verbal and physical quarreling, means kalaha shila. So this is the condition may causes the chances of baby in the epilepsy chances more possible in that child. Second is if not follow the brahmacharya. See, in that conditions also have the changes in the mental conditions. If depression in the pregnancy time, it may causes the short life, means it decreases the lifespan of the children. Along with same condition, if we can say lazy conditions, we can, हमेशा अगर हम daily activity को भी stop कर देते हैं, it also causes some changes in the mind and even obviously try to hurt some other persons. If we uses the daytime sleep or we can say more sleep, it may causes the tandralu, mandabuddhi, alpagni children. So sleepiness, low digestive power and buddhi, it is the condition may be possible in the child. If we have addiction, it may obviously causes the smriti changes, chitta problem. Madhur, this is also shared by as in the present era, in Prameh is the genetic conditions and very much prevalent in the India. They also said that if we take the more sweet during the pregnancy, have a more chances of diabetes in the future, or maybe at the sahaj diabetes is also possible. Amla, lavan, katu, tiksha, all are may causes the different kinds of diseases also. So not only the ahar, Vihar is also important. How we can change the mental conditions and physical changes and how we can prevent the disease. As in the present condition, this is comes under the nutrogenomic. So accordingly, as we want, we can design our children. So this is the condition how we can prevent this. And after birth, postpartum conditions, most important things is how to improve the mother conditions. Mother health is most important to improve the and retain her health as early as possible. So for this, we give the some Sutika Charya, means Ushnodak, Parishek, Yabagu or we can say Dashmul Pan, Rasna Saptak, Twat also. All these may decreases the Vata dosha, and along with the Vata dosha, we try to increase the Agni, like Pipli, Panchpol is important for the improving the Agni. So Swasthavritta, according to Swasthavritta, Sutika Charya is also important after the in the postpartum condition to improve the mother health. Along with this, give the Madhur Ahar, Madhur Amla Lavan Boost Ahara, Cheer preparation, and along with they give the Cheer Janan Aushadhi also, like Virana Sasti Shalik Ichudargu, Pushkas, or Stanne Janan, Stanne Shodhan, for the care of children, baby, first starting from the first days. So how to improve the child health, it also depends on the mother health. If mother is healthy and able to produce the mother milk proper amount and in the proper quality, then we can maintain the child health also. So along with this, we give the mother and along with the means we can say Jivniya Gan, Bringhaniya Gan also important for improving the mother health. And along with this, child is required special care, like we can say immunization for the prevention of diseases. So Ayurveda mentioned that Swarna Prasan and different preparations of the Swarna, we can improve the immunity also. Along with this, regular use of Nasya, Abhyang, Rasayan is also important for like Kumara Kalyan Grata. All these important for the improving the child health. So this is the condition how to improve the child health up to and achieve their mental health properly. Growth of the child is also proper. Not only the immunization is sufficient to improve the health and prevent the infection. Obviously, we require some disinfectant also. As mentioned in the Acharya, in the Charak Samhita, Dhupan Dravya, regular Dhupan of the place, home, and their dresses, and all these things should be disinfected. So how we can do this? Obviously, we use the some Dhupan Dravya like Yab Sarsap Atsi, Hingu, Biblu, Vachachurak, Vayastha Golum, Jitila, Palanka Shashu, Nigr. So all these use as a we can say Dhupan Dravya for the prevention of infection. In the Grihi also, means local disinfection is also important. And बच्चों का पालन हमें तब तक करना चाहिए जब तक when they attain the kumara or yovana प्राप्त धर्म अर्थ कौशलम आगनम चा अनुपालियत, means जब तक वे जो चाइल्ड है वो फुल डेवलप नहीं हो जाते हैं तब तक हमें उनका पालन करना चाहिए. So this is my last slide. And lastly, we can say if we can improve the lifestyle of the lady, it also improves the conditions of quality of child, and it decreases the morbidity and mortality, and also use of brahmacharya. Following the brahmacharya, it work also as a contraceptive conditions in the previous time. So at last, we can say this is the condition how we can attain all and achieve the aim of RCH program from the aspect of Ayush and from the aspect of Ayurveda. Thank you. Thank you so much.
Thank you, Dr. Shalini. Very well, very good presentation.
Thank you,
and well done, well done. बहुत ही अच्छा, very well, very good. And you have covered all the areas and
thank you, sir.
Great awareness done by you.
Thank you, sir.
And before I invite our next guest speaker, Dr. Tejinder Singh, I would like to make a small appeal that since tomorrow the new month is going to start, and we have circulated the new month program.
Yes,
Please,
sir.
those who are here, not only the Swasthavritta
Yes.
department or the Japan, all the guest speakers and all the say our participants and the scholars, those who are here, please communicate your choice topics as early as
Yes, sir.
possible, so that we will be in
Yes.
position to make you guest speakers on coming days. Thank you so much. And after
I'm very
this appeal,
thankful, sir. Pawan sir, अग्निहोत्री सर एंड सभी आयुष समृद्धि ऑर्गेनाइजेशन को बहुत बहुत धन्यवाद करती
you
हूँ
are
कि
most
मुझे
welcome.
मौका
You are
दिया.
most welcome. Please do join again and again. The whole
Yes, sir.
month is
Sure,
with
sir.
you. Okay. Now I would
Thank
like to
you,
invite
sir.
our next guest speaker of today's program, RCH program, Dr. Tejinder Singh. He is pursuing MD Swasthavritta from IRES College, Intl IRES College, Dehradun. Dr. Tejinder Singh, namaskar. Dr. Professor Vishnu Prasad Sharma ji, yeah, our Vice President, he is here.
नमस्कार अग्निहोत्री जी. नमस्कार. नमस्कार.
Dr. Tejinder Singh, please join. We are already running late, and we have to conduct our next webinar.
हमको कुछ बोलना है क्या अग्निहोत्री जी?
अभी हमारा फोर्थ हमारे आज के गेस्ट स्पीकर डॉक्टर तेजिंदर सिंह को हमने इनवाइट किया है.
हाँ, ठीक ठीक.
उनका प्रेजेंटेशन हो जाए, फिर आपसे आरसी वचन लेंगे. और रेड्डी साहब यहाँ से जुड़े अगर रहेंगे तो उनसे भी चर्चा कर लेंगे. डॉक्टर तेजिंदर सिंह, प्लीज ज्वाइन, स्टार्ट स्पीकिंग. यू माइट बी आई थिंक सेटिंग योर पीपीटी एटसेट्रा. या यस यस द सेम. आज बिजली नहीं आ रही, इन्वर्टर पर ये सारा बिल्कुल बैटरी ना बैठ जाए, इसका खौफ लग रहा है मुझे.
सर अभी ऑलरेडी शेयर हो रही है स्क्रीन इसमें.
अच्छा, प्लीज स्टॉप शेयरिंग. दैट्स व्हाई आई अंडरस्टूड दैट देयर इज द सेम स्लाइड विद यू आल्सो. डॉक्टर शालिनी, यू आर रिक्वेस्टेड टू प्लीज स्टॉप शेयरिंग.
हाँ सर, बस वेट. यस.
Namaskar, a very good evening to all of you. My name is Dr. Tejendra. I'm District Department for Swasthavritta. Today I'm presenting my topic on reproductive and child healthcare programs. This one is like a logo of RCH, Comprehensive RCH Society Services. Historical background. In 1952, National Family Planning Program started. In 1977, National Family Welfare Program started. In 1985, UIP, Universal Immunization Program started. In 1992, Child Survival and Motherhood Program started. In 1997, RCH, Reproductive and Child Health Phase 1 started. What is RCH Program 1? It's about definition. People have the ability to reproduce and regulate their fertility. Women are able to go through pregnancy and childbirth safety. The outcome of pregnancy is successful in terms of maternal and infant survival and well-being, and couples are able to have sexual relations free of fear of pregnancies and of contracting diseases. ये एक डेफिनेशन बताई गई थी आरसीएच प्रोग्राम फर्स्ट की. व्हाट आर द ऑब्जेक्टिव्स? इसके जो इसमें आरसीएच प्रोग्राम के क्या क्या ऑब्जेक्टिव्स हैं? इमीडिएट, इंटरमीडिएट एंड अल्टीमेट. द फर्स्ट वन इज इमीडिएट. to promote health of mother and children. Second is intermediate objective, to reduce IMR and MMR. Third one is ultimate objective, that is population stabilization. Now, intervention strategies क्या हैं RCH की? Prevention and management of unwanted pregnancies. Second is maternal care child survival. Third is prevention and management of RTI and STIs. And the last one is prevention of HIV or AIDS. Aim क्या क्या है RCH program second की? To reduce infant mortality rate IMR, reduce maternal mortality rate, total fertility rate, to increase couple protection rate and immunization coverage, especially in rural areas. And components of RCH second, the one is population stabilization, second is maternal health, third is newborn care and child health, another is adolescent health, control of RTI and STIs, another one is urban and tribal health, and the last is monitoring and evaluation. न्यूअर स्कीम्स एंड सर्विसेज, एज अभी पूर्वक्ताओं ने मैम सर लोगों ने अभी बताया कि दीज आर द स्कीम्स, वंदे भारत स्कीम, जननी सुरक्षा योजना, ट्रेनिंग ऑफ ट्रेडिशनल बर्थ अटेंडेंट्स, ट्रेनिंग ऑफ एमओज, सेफ अबॉर्शन सर्विसेज, medical method like mifepristone, misoprostol, manual vacuum aspiration. These are the newer schemes and services under RCH programs. Importance of child health, अगर हम बात करेंगे mainly child health की, so these are the future generation. Children are the future of society and their health determines the health of nation. And these are the vulnerable population. Children are most susceptible to illnesses and infection due to developing immune systems. Economic burden, poor child health can lead to increased health care cost and lost productivity. Social and emotional development, good health is essential for social, emotional and cognitive development. ओवरव्यू ऑफ नेशनल हेल्थ प्रोग्राम, अगर हम इसमें नेशनल प्रोग्राम की बात करें तो आरसीएच के साथ साथ में क्या क्या ICDS हैं, RMNCH है, नेशनल हेल्थ मिशन है, नेशनल हेल्थ मिशन, UIP, पल्स प्रोग्राम, नेशनल न्यूट्रिशन मिशन, नेशनल राष्ट्रीय बाल स्वास्थ्य कार्यक्रम RBS के, the first is ICDS launched in 1975. इसका एम तो था holistic development of children under 6 years. Services, supplementary nutrition, immunization, health checkups, referral services, preschool education, target beneficiaries, children under 6 years, pregnant and lactating women. Another is RMCH, reproductive maternal and newborn child and adolescent health, launched in 2013. इसका जो मेन एम था comprehensive approach to reduce mortality and morbidity. The focus areas are reproductive health, maternal health, newborn health, child health, and adolescent health. Strategies are strengthening the healthcare systems, improving access to services, enhancing quality of care, promoting community engagement. Goals are reduce MMR, reduce IMR, and reduce TFR. Another is NHM, National Health Mission, launched in 2005. The purpose was improve healthcare delivery, especially for vulnerable populations. Components are NRHM, and second is NUHM. One is for rural health, another is for urban health. Focus areas are maternal and child health, infectious diseases, non-communicable diseases, healthcare infrastructure. Goals are reduce MMR, reduce IMR, and increase access to healthcare services. Strategies, strengthening healthcare infrastructure, improving service delivery, and promoting community engagement. Another is UIP, which we all know कि जो इम्यूनेशन प्रोग्राम बनाया गया था कि कम से कम इसमें चाइल्ड जो इसमें मोर्टेलिटी रेट है वो कम हो एंड उनकी कैसे इम्यूनिटी हम बूस्ट अप करें. Launched in 1985, vaccinate to all, the aim was vaccinate to all children against vulnerable diseases and prevent all the diseases, upcoming diseases. The vaccines are BCG, DPT, OPV, measles, hepatitis B, plus influenza B, rota, PCV. And goals are eliminate vaccine preventable disease, reduce morbidity and mortality, improve herd immunity. Strategies, routine immunization, pulse polio immunization, and outreach sessions. Another is National Nutrition Mission, NNM, launched in 2018. The aim was reduce malnutrition in stunting in children. Goals were reduce stunting in children under 6 years by 2% per annum, reduce underweight prevalence by 2% per annum, and reduce low birth by 2% per annum. reduce anemia in women and children 3% per annum. And strategies are strengthening ICDs and NHM, community engagement and awareness. Key components are पोषण अभियान, जो काफी एक अभी उसके अच्छे आउटपुट रिजल्ट्स आए हैं. न्यूट्रिशन कैंपेन चलाया गया कि कैसे स्कूल्स में कैसे बच्चों के मिलेट्स उसमें ऐड ऑन किए जाएं, जो मिड डे मील में उनके उनके एज ए मील्स में इंस्टेड ऑफ नॉर्मल मील्स मिलेट्स का जो उनके लोकल फूड हैं, लोकल वेजिटेबल्स हैं, फ्रूट्स हैं, उनको इंक्लूड किया जाए. राष्ट्रीय बाल स्वास्थ्य कार्यक्रम आरबीएस के लॉन्च इन 2013. ये सारे इनमें स्कूलों को सारे कवर किया जाता है. उनमें जो भी रूटीन चेकअप के बाद में एक पहले उनको देखा जाता है कि लाइक इफ देयर एनीथिंग, तो उनको रेफर करके कुछ कंडीशन कंसर्निंग इश्यूज हैं तो उनको फिर डिस्ट्रिक्ट हॉस्पिटल देन फर्दर रेफरल हॉस्पिटल में रेफर किया जाता है. तो उनके जो फोकस एरियाज लाइक 4Ds, डिफेक्ट एट बर्थ, डेफिशिएंसी, डिजीजेस एंड डेवलपमेंटल delays, and some other 30 health conditions like congenital heart disease, cleft lip and palate, vision and hearing impairments, neurological disorders. The strategies are screening at schools and Anganwadi centers, the referral and treatment at district hospitals, and community awareness and engagement. इसके भी काफी अच्छे आउटपुट हैं. अर्ली कम एज में और अर्ली स्टेज में वो जैसे कंजेनिटल हार्ट डिजीजेस डिटेक्ट हो रही हैं तो उनको प्रॉपर ट्रीटमेंट मिल पा रहा है. Early detection and management of health conditions, reduce morbidity and mortality, and improve quality of life. These are the goals of RPS के पूरा. And lastly, as a conclusion, these all RCH and national health programs have significantly improved child health and maternal health outcomes in India. Success is decline in infant and maternal mortality rates, increases in immunization coverage, reduction in malnutrition and stunting, improved access to healthcare services. Challenges are inequitable access to healthcare, quality of care, and sustainability and funding. Way forward is strengthening existing programs, and these are the emerging challenges to addressing emerging challenges and ensuring quality and equality of care. And lastly, I would like to thank you so much, Professor Agnitri sir, for giving me guidance, and Professor Vishnu sir and Professor Pawan Sharma sir giving me such a great platform. Thank you so much, sir. सर इसमें वीडियो विजिबल नहीं हो पा रहा है मेरा.
कोई बात नहीं, यहाँ भी बिजली गई हुई है. अब चार्जर उसको 20% है. थैंक यू सो मच डॉक्टर तेजिंदर. थैंक यू सो मच. Definitely, even being the fourth and last speaker, you gave some new information apart from the already made available by our previous speakers. So very good. Keep it up, and our greetings for you. And do join again, and please communicate your choice topics for next month.
Sure, sir.
Now, I think Professor Reddy sir is with us, and he has started our today's program. So I would like to request him to please give some benedictions to all of us, to all the guest speakers, and make some concluding remarks on the presentations of the participants. Yes, namaskar.
Yes, sir. Namaskar, sir. It was very interesting, sir. And all youngsters, especially Tejendra and Shalini Mishra, they have gathered a nice information. And Shalini Mishra has given more practical aspects of the child nutrition and also pregnant nutrition to reduce IMR and MMR. And Tejas also briefed everything in a 19 slides. Very nice. And another madam, Gaikwad madam also, she has given a